Okay, today is March 10th, 2014, and this is the first Scrambler therapy session on this 42-year-old white male who suffered an injury to his right thumb and his neurovascular bundle at the base of the thumb, and it has been repaired, and he has been seeing hand surgeon specialists, and he's had a major gaping laceration of this thumb radial aspect and palmar aspect of the thumb with a graft reconstruction, and he has total separation of the flexor pollicis longus here, where he has inability to flex this thumb actively, although passively I can do it. He presented today to Calmar Pain Relief with an initial pain persisting in this thumb that is a classic neuropathic pain description, and he describes it as a VAS score of 8 out of 10 prior to the Scrambler therapy. He presently has started his very first Scrambler therapy treatment session, and presently, now Mark, what is the pain that you have in that thumb?
I'm not feeling any pain to mention whatsoever.
Okay, so your VAS score now went from an 8 to a 0.
It's actually feeling good. It's starting to warm up.
All right, you're starting to feel as if the thumb is reestablishing a warm feeling equal to the other fingers.
Yes.
Okay. Can you turn this over for me? And
yep.
We'll see here where we have the lead placements. And now, before we started, I couldn't touch you much over here without you suffering pain.
True.
All right. And now we can touch that. And let's see what you can do now. You've had trouble holding and grasping things, and I'm going to put this here, and I want you to pick that up and squeeze it with that thumb. Okay, now how does that feel?
As I'm squeezing right now, I should be getting a lot of pain, but I'm not. If I wasn't being treated right now, I can tell you that this tendon here would be on fire. I would be in terrible pain.
All right, and with the electrodes on you right now, you don't feel any pain doing this?
It's remarkable. I feel zero pain.
Okay. Now, try squeezing that bottle a little bit. Okay. Now, you see you got a little bit of a squeeze in there, okay? And that's not eliciting any pain in you?
None whatsoever.
None whatsoever. Okay. Don't squeeze it too hard. We're going to get gel all over the place. Okay. Now, let's see here. I'm going to give you my fingers. Okay, here. And let's see you squeeze now, okay? All right. Very good. Excellent, excellent, excellent. All right, let go.
Okay.
All right, good. Good thing I put them like that, or you would have crushed me there. Okay, so again, today is your very first Scrambler therapy treatment, and I got to basically tell you that based on our experience, and my experience in over 800 patients with Scrambler therapy with various disorders, complex regional pain syndrome and post-surgical nerve lesion neuropathy, especially patients who respond like this with the very first Scrambler therapy session, especially within minutes, is the classic response we're looking for, and it usually equates to a restoration of the normal pain, non-pain, cybernetic central nervous system feedback system from the periphery to the brain and back. And I do expect you to improve dramatically and have a continual successful series of treatments with Scrambler therapy, and hopefully resume you to as much functional use as possible with the loss of the flexor tendon in the thumb, but hopefully will rid you of all that severe pain, and 8 out of 10 is a severe pain in that thumb. Okay? Does that sound like a plan?
I'm very pleased with what I'm feeling right now.
All right, and again, here's the date and the case number.